Hello, once again. In this video, we will be looking at various parameters of general examination. First step for general examination is assessing patient's physical and psychological state. Let's look at some key points and tricks to evaluate. For general state of health, observe the patient's energy levels, skin color, and any visible signs of distress or discomfort. Look for fatigue, pallor, or signs of acute illnesses. So, Mr. Wilson, how are you?
Nothing much, doctor.
Excuse me. Have you not been doing well, sir?
No, doctor, just a minor flu, I guess.
What did you note? 5 seconds to see if you got it. The trick here is to compare the patient's current appearance and energy levels with their previous healthy state, if possible. Any significant changes may indicate a change in health status. Patient looks tired. There is no signs of pallor or skin color change noted on inspection. He also sneezed with a hand movement denoting muscle ache, which could possibly indicate an acute onset of an illness. Next is measuring the patient's height and weight. This helps determine their body mass index. Assessing their build can hint their natural body shape and metabolism. The trick is to maintain a standardized measuring process and record the measurements accurately for future comparisons and evaluation. Further, observe patients' posture and motor activity to reveal important clues about their neuromuscular health and functioning. Look for signs of discomfort, pain, tremors, or involuntary movements. Hello, Mr. Paul. What brings you here today?
Doctor, I had a fall today morning, after which I am not able to move my arm.
Did you have any other injuries, like to your head or to your back?
No, doctor. I don't recollect so.
Can you walk for me in this room, so that I can evaluate better?
A few moments later.
I see you have no such change in your walking pattern. The simple trick is to ask the patient to perform simple movements by himself, or walk a short distance, to assess their range of motion and analyze the gait. The way a patient presents themselves can offer insights into their mental and emotional state. Pay attention to their dress, grooming habits, and personal hygiene. It is very important to be non-judgmental and considerate when discussing personal grooming or hygiene concerns. Use open-ended questions to encourage honest communication. Unusual body odors or breath can be indicative of certain medical conditions or poor hygiene. Pay attention to any noticeable smells during the examination. Approach this aspect of assessment sensitively, as patients may feel embarrassed or uncomfortable. Address the issue with empathy and offer practical solutions or medical advice, if necessary. Assessing the patient's mannerisms and affect can give insights into their emotional and psychological state. Observe how they interact and their responses to various stimuli. So, Pauline, how was your week? Could you tell the group what happened?
I just don't know. Why does everyone aim at me always? People are just after my life. I may never be good for anyone. Someday maybe. Someday.
Don't worry, Pauline. We will work this out and get through it. We should use our active listening skills to understand the patient's reactions better. Be attentive to verbal and nonverbal cues, such as tone of voice and body language. Also evaluate for patient's clarity and coherence of speech, and note if any abnormalities, such as slurring or stuttering, is heard. As you noted, the patient had a sudden outbreak of anger, followed by a change in emotion, and finally ending with muttering. To conclude this video, there are some observations that physicians should know. It's essential to approach each aspect with sensitivity, empathy, and respect, for the patient's privacy and cultural background is important. Regularly updating the patient's records and comparing changes over time can aid in detecting health trends and potential concerns more effectively. Hope this video did bring some major insights to your knowledge. See you soon in the next video.